Hi, this is Eric Ruderman from Northwestern University in Chicago, coming to you live for Room Now from the Eular 2024 meeting in Vienna, Austria. I've been looking at some of the abstracts related to spondyloarthritis at this meeting and thinking about the implications for clinical practice. One of the things that's been interesting is that there are several abstracts looking at whether therapies, particularly biologic therapies, inhibit structural change, either in the spine or the sacroiliac joint in axial spondyloarthritis. Two that were most notable was one looking at a post hoc analysis of a trial with ixekizumab. This was OP0046. They looked at MRI imaging and looked at the impact of ixekizumab therapy on structural lesions in the sacroiliac joint. They found that treatment with ixekizumab reduced bone marrow edema, which we knew it reduces inflammation, but they were also able to show that there was some backfill of existing erosions in the sacroiliac joint and additional fat deposition. The implication for this is that they were filling in erosions as a response to therapy. I happened to be at this particular presentation, and I asked the presenter about the clinical significance of this, and he honestly couldn't tell. That the issue of filling in erosions is an interesting imaging finding, but whether it translates into real clinical benefit and whether this is really healing of those erosions, healing of the bone, or this is just filling it in with tissue that is structural but is not normal bone, I don't think we know. There's no histologic data to show what's happening here. There was another abstract presented at this meeting, POS0058, a poster that essentially looked at the same thing with bimekizumab, the newer IL-17 inhibitor that inhibits both IL-17A and IL-17F. They showed the same thing. The authors were many of the same authors. Also showed that treatment with this IL-17 inhibitor seemed to improve the structural changes at the sacroiliac joint, filling in some of these erosions. But again, is this truly backfill and repair, or is this just filling in with some sort of non-functional structural tissue? We don't really know. Ultimately, I'm not sure how important these findings are going to be. It gives us some insight into mechanism of these drugs, but it doesn't really tell us if this is going to improve outcomes in patients, because most of the symptoms in our axial spondyloarthritis patients are related to inflammation and not structural change or structural damage. So I think there'll be more to come on this, and I think that hopefully some of these groups will give us some information on the potential clinical relevance of what they're seeing on the MRIs, but we'll have to wait for that. Stay tuned here on Room Now for more information from Eular 2024 in Vienna. See you soon.